All right, thank you, Rod. He actually set me up perfectly because he was talking about the limited efficacy and limited knowledge about this topic. And I was sitting here thinking that it was probably one of the only campaigns I've been involved in at Health Initiative for Men in which I kind of think it was like, well, why do I have to do it? I don't think that any of us were really racing to claim this one, and not because we didn't see the need or the interest, but I think because we recognized how little we know and how complex it is, and I think we also, many of us very personally have seen the impacts that meth use and sexualized meth use are having on the GBMSM community. We don't have a devoted substance use program at Health Initiative for Men. None of us are experts or have degrees in substance use. And so it felt like a lot to take on. I'll just say that at the outset. I feel still like it's a lot to try and get my head around. But I am really, really grateful for the folks that are sitting at this table, Rod and Nate in particular, who helped provide what data we do know about meth use and sexualized meth use, especially in Vancouver in our context, which gave us something to go on. So thank you guys. So a little bit of history of our campaign. In 2016, Health Initiative for Men got kind of just a cold call, like we typically do every year, from Vancouver Queer Film Festival. And they asked us if we would like to co-host and participate in a panel, along with Nate, for a screening of the Vice documentary Chemsex, which is devoted towards kind of covering what's happening in the London chemsex scene. And right off the bat, I will tell you that I don't think the terms are really interchangeable in a Canadian or British context. So when they say chemsex in the UK, broadly what they would be referring to is the intersection of three drug combos, mephedrone, GLB or GHB, and crystal meth. And so right off the bat, it's a little bit different phenomenon. But we did decide to screen it. Matthew Taylor, coworker who is on leave, who is going to participate in the panel and is not able to be here today, he and I watched it first, and we heard from some folks in the community, like straight off the bat, when they realized that him was considering co-hosting it, that we might want to proceed with caution, and that the film itself had earned a reputation as being pretty salacious, and there was a lot of pushback, especially in the UK, about the ways that it was portraying gay men's sex lives, and whether or not it was basically showing too much. And so we watched it. We felt like it was a really important film, and we also felt, though, that it was sufficiently brazen enough that we wanted to get the buy-in of the full staff. So we actually screened it for the full staff, and afterwards had 100% buy-in. Everybody at Health Initiative for Men felt like we really needed to sign on to the film, that it was that important. So really, basically, Chemsex, the film, explores the intersection of this kind of three-drug combo use, and especially like the use of hookup apps, internalized homophobia, and social isolation, and how all of these things are feeding each other internally. The really great thing, and I think a turning point for us as an agency, and in some ways some of this work in the community, was that David Stewart, who is the chemsex lead at 50 Dean Street Clinic in London, also was invited to participate in the panel, came and attended, and then participated in a community forum for service providers and partner agencies at Health Initiative for Men. So I think right away, when we hosted the panel and saw the screening in Vancouver, one of the first things that happened was an individual in the audience stood up and said, I want everyone to know, I'm paraphrasing here, I want everyone to know that this is happening right now in Vancouver. This is not something that is happening just in London. This is not happening just in LA. These kinds of very, very extended and quite high-risk sexual encounters that are facilitated through sexualized meth use and hookup apps are taking place here in Vancouver regularly. And so I think that was a kind of first wake-up call. The subsequent discussion and community forum and just a lot of follow-up conversations really started to help us learn more about the state of sexualized crystal use in Vancouver and what we know and what we don't know. And I would say I kind of distilled it down to three key points that we heard either in the screening or following. So one, we felt, and a lot of our partners, especially some of the outreach nurses and especially those working in bathhouses, felt that sexualized drug use and especially crystal use was increasingly present in group sex scenarios. The increase was mostly observed in anecdotal form, although we, thanks to Momentum, do have some research data that we can draw from. Again, the nurses were key observers. We also heard from community partners like bathhouse managers that they were just starting to see a lot more evidence of crystal use in their settings. And especially, I think important is that we started to hear that meth use appeared to be changing a little bit. More guys appeared to be slamming, and some of the nurses reported particularly that slamming was now kind of the preferred route of initiation. So whereas guys would previously smoke and then go on to slamming or injecting, they were starting for their very first time by slamming. But I think most importantly, there was a lot of consensus amongst everybody that was involved that it was time that Vancouver did something, that those of us who were working in the field could not kind of sit back and say, like, I don't know what to do. We need to wait until we have all our ducks in a row. And I think that David Stewart, in his work with him and also his work with some other agencies, I know that, Sarah, I think he spent a day with you guys at YouthCo too. One of the things that David really shifted our thinking on at him was, with a topic like this, if you wait until you have all of your ducks in a row, you're never going to get to a point where you are actually doing anything. You can't wait until everybody has licensure in substance use treatment. You have to recognize that sometimes we just need to act. And so his philosophy and 5016 Street's philosophy is very much, there's no reason why anybody who's working on the staff of a prominent gay men's health organization cannot take 5 or 10 minutes and sit down with somebody and talk to them about their crystal use and just listen, and if they need some referrals, make some referrals. So I think he demystified it a bit at the outset, which was really, really a great starting point. So he's a phenomenal source of expertise. I would encourage everybody to go to 5016 Street's page that David curates on chemsex. He has some fantastic videos that he hosts on there. They're kind of like little 2-minute snapshots for crystal users on everything from, taking a break from sex to just different harm reduction methods. But I think the one thing that David shared with all of us that really made us change our thinking was he had actually got started at 5016 Street because he was doing community service. And I don't know where he got the idea, but he was like, I wonder how many guys are coming in for post-exposure prophylaxis because of the use of party drugs. And so he asked the 5016 Street clinics if he could just record that data. And what he found was, I think, 98% of the PEP exposures over a month were related to, the chemsex scene. And so I think that was, a realization for us as to just what kind and how specific these risks can be for gay guys. And then again, a note, chemsex isn't really a thing in Vancouver, but sexualized meth and other drug use is. And so David helped us to kind of think about, mephedrone is not really a thing in Canada, although I'm not sure it's not, but I haven't heard of this. But, for the expert reference committee, we talked about this. Are we going to try and talk about all quote unquote party and play behavior? And we felt like not necessarily. We feel like there's a specific need in the community to talk about crystal right now. I think David also really challenged us to think about, just like Rod was saying, what if we started to look at things really from a sexual health perspective and didn't just keep it from this in this barrier of substance use only. So we really just are concentrating on the fact that for most gay guys who use crystal meth, the most likely negative health outcomes that they will experience are sexual health related. And I think that's one of the things personally that's been the biggest challenge for me to always continue to come back to. I think socially in Vancouver and broadly, just as a gay guy, the degree to which meth is really, really stigmatized and judged in our community is rampant, it's widespread, and it's really shocking. And so, to think about approaching crystal and sexualized crystal use as these guys shouldn't have to stop, they may not want to stop, but we should just do what we can to help them, protect themselves from some negative health outcomes. It was, I think, a big shift. I think we also recognize that resources and interventions are limited, as Rod noted, and that we have yet to have everything in place to fully address the spectrum of crystal use that we see. But again, overcomplicating development of any program until you have everything in place really just risks inaction. And inaction risks further increase in sexualized meth use. Will had noted this morning that, while the NHS in the UK has been waiting on PrEP, like how many guys have seroconverted. And I would say the same thing. The longer we wait to try and start having really meaningful community dialogue and engagement around crystal, the more guys will be using it, the more guys will have these negative sexual health outcomes and other mental health and physical health outcomes. So we had 2 expert reference groups. So one that was primarily like sexual health and our health center intervention. So working with some of the nurses we work with, Jody from CBRC, Rod, Nate, and then a substance use kind of like / mental health lead. And so that was Aaron Purdy, our program manager for mental health. And then Matthew Taylor, who's our program manager for outreach, participated in both. And basically what we were trying to figure out is what are the pieces that we need to have in place within the health center that really just, again, focus on the sexual health outcomes. But then also, what do we do for the guys that, are kind of in that pre-contemplation phase that want to sit down and talk to somebody or need, a recommendation or a referral to a substance use treatment program. So that was why we split the 2. As best we could, we reviewed all of our local, national, and international data and trends on sexualized meth use, and then made recommendations basically about what the appropriate pathways would be. And again, thanks to David Stewart, who helped me a lot individually with this. We just came down to 3 core questions. If you are a crystal user and you primarily use crystal in sexual settings, how do you feel about that? Who do you talk to about that? And what do you do about that? So we really wanted this to be a very, very low barrier intervention. Again, always focusing that the intent of this campaign in particular is crystal's use in relation to sexual health risks and negative outcomes. And that we recognize, again, that those appropriate pathways for a more full spectrum intervention are really, really important, but that this intervention doesn't presume that all crystal meth users want nor need to stop. This intervention does presume that sexual and mental health risks associated with crystal use can be reduced if individuals are provided with the right resources. So hopefully I can get this to work. There we go. And apologies, this won't look quite right because, we have to do something.
Drag the window to the right.
Let's see here.
Oh, I see.
Okay. Yes, now I need to refresh. I don't know where it went.
Just in the top right, there's a little to the right. Keep going.
Can you see?
I can't see what's on the actual screen up there.
I can't.
No, we don't.
Can anyone see? You're close.
Oh, perfect. Thank you, Sean. Okay, so this is mobile optimized. And the reason why it's mobile optimized is so we wanted to actually capture what would be a text conversation on a phone. And the reason why we wanted to do that was because we wanted to really recognize that for sexualized meth use, mobile phones and hookup apps are kind of like a really crucial part, and they're a mediating factor in which a lot of this stuff takes place. Was interesting, we did a couple focus groups and some key informant interviews, and nobody could agree on anything, really, in terms of what they liked. And I think it reflects back on both the stigmatization of crystal use within our community, and then also, I think, a kind of reaction for those of us who work in the field that we don't want to stigmatize crystal use. And so kind of fell into 2 different camps. There were some images that were very, very neutral, and it was basically, and you'll see them as I go further into the site, but there were some very neutral messages that kind of like had some hidden or coded visual imagery of cell phones, but it was just two models. And we did that because we didn't want to stigmatize crystal use, and we wanted and thought we were presenting this very kind of neutral visual language. And then when we did a focus group with some experiential guys who actually do engage in sexualized crystal use, they were like, this is a waste of time. Nobody's gonna get it, nobody's gonna pay attention, nobody's gonna even like care enough to like dive that deeply into it. So, this should be interesting. Okay. So what we did is we have our 3 core questions here. And then you can see here, so this is just, we did end up reusing some of the visual images, so these are just some of the snapshots. But for how do you feel? So we just wanted to be really upfront. So let's talk about sex and crystal meth. We wanted to start, and I felt like it was important, and this is something that, you know, in our support that we've gotten from AIDS Community of Toronto, who've been a great support to us. They do the classic harm reduction piece with crystal use, but they also recognize up front that this is a drug that has tremendous addictive potential. And I actually think that that's important, and that's something that, you know, is a very, very tricky line to navigate. I know some of our previous work on other campaigns with like the High Life, it's like, where do you put in the fact that like, yeah, we want guys to use and we don't want to judge and we want people to use safely. We also want you to recognize that if you haven't used, this is a substance that for some of you will have consequences well beyond sexual health outcomes. So we did try to focus on some of that, but just really like, you know, starting with definitions and then really like super self-assessment questions. So, you know, are you happy with your meth use? When was the last time you had sober sex or sex that you weren't on crystal with? Has crystal impacted your physical health? Has crystal impacted your relationships or daily life? And just really to, you know, not to tell somebody if you answer one of these questions, yes, you need to get into a treatment program, or, you know, you're gonna catch gonorrhea, or you might transmit or contract HIV, but really just to get them contemplating, you know, do they want to talk to somebody? Now let's see if I can, okay. Technology. Yeah, and so even the emojis, that was a crash course, is they were like, there's a very specific emoji language associated with crystal use. And then conversely, when I had shown this to some of the other folks who participated, they were like, oh my God, that's like, isn't that really, really stigmatizing? And I was like, well, that's what the experiential users actually wanted to see, and that's who we're trying to get, so. And then who do you talk to is, again, up front, we wanted folks to recognize that there are sources available if people feel like they need more concrete or substantive treatment programs. But any of these are just different kind of modules that go about, you know, to taking an individual assessment and taking some steps. And again, always going back to really focusing on the sexual health outcomes, negotiating safer sex while on crystal, reducing crystal use, taking a break from crystal, taking a break from sex and others. I think one of the challenges as I was doing this research is, I don't know if you came across this, Rod, but there, as a gay men's health organization, there are pieces that they recommend, and 5016 Street recommends, when dealing with sexualized crystal use that are very counterintuitive to a sex-positive organization. Like telling guys you might need to stop having sex for 6 months. You might need to delete all the hookup apps off your phone indefinitely. Not things that like are super associated with him, and not things that like our community is really used to hearing, but things that we do know tend to lead to some better kind of short-term outcomes for individuals who do want to do things like take a break from crystal. And then, one more time. Then this, again, was specifically just the tools that we could identify that were really protective in sexualized crystal use, and then some very specific sexual health risks, and also some risks that weren't necessarily sexual health, such as things that could be contracted via slamming, but might take place in a sexual context. And then, of course, because we all know how serious the fentanyl epidemic is right now in Vancouver, there was some information on that. Okay. There we go. So that's a brief overview of the campaign itself. So I think our next steps are definitely developing the next tier of what the program looks like. So this month I will be going to Toronto. Aaron has already gone to Toronto to do some work with ACT and learn about their peer-led support model. Réseau's Mombuzz has finally launched, which is their online crystal resource. 5016 Street, of course, has been a great support and continues to be a great support. The CFE and the Center for Substance Use has been fantastic, and we wouldn't know anything, I think, without Momentum and Engage especially. But I think it's challenging. It's challenging even at the nursing level. I think some of the nurses are a bit afraid to touch this. You know, we've had conversations around, oh, could you ask these 3 questions to everyone who comes through the door? And it's like, oh, this is going to turn a half-an-hour appointment into like crisis management. What do we do with that? And so this was where Aaron really did put in a lot of work with AIDS Vancouver's Health Promotion Case Management Program to have them be that kind of frontline resource. So 2 nights a week, we will have somebody at our Davie Street Health Center who can always sit down and talk to somebody if they have questions about their crystal and sexual health. And we are working on the next phase. I think that's it for me. I had one more slide, but I don't know where it went.
That's gone.